Hey there, my name is Joshua Grainer. I'm a men's health specialist. And part of what it is that I try to do for my clients, for men, for my listeners, for the, people that subscribe to my work is to help you have and to live happier, healthier, more pain-free lives, to improve your performance and to increase the likelihood that you'll live longer. At least that's my hope for myself and also for the people I work with. And part of that is chronic pain. And, you know, by recording this video and this, essentially this series of videos, I'm going back to my roots because, some of you may know, some of you may not know that I started my clinical work in chronic pain. And of the different types of chronic pain that I dealt with, neck pain and back pain was, probably 80% of the patients that I saw, that I treated. That's what they came in for. The other 10 to 20% were things like fibromyalgia and migraine headaches. But the focus of this video, of this talk today, is specifically about chronic neck and shoulder pain, right? Because this is something that affects so many people. A lot of people deal with it, a lot of guys deal with it, and it really impacts our quality of life. To the extent that for some people, when that pain gets really bad, it becomes really distracting. It becomes hard to focus on your work, or hard to focus if you're at dinner, having a good dinner conversation, whatever it is, because that pain becomes really distracting. Because in many ways, that pain we can ignore it for a certain period of time, but then it almost becomes all encompassing. It really begins to pull our attention away from what it is that we want to be focusing on. So I've divided this series into two different videos. This video, we're actually going to be going a little bit into the physiology. I'm going to be explaining how and why this happens, like what this type of pain is, right? Because it's so common. But a lot of patients, a lot of people will go to their doctors and say, I have this pain. What is it? And doctors will just say, well, it's just muscle pain, or it's just nerve pain. And then that's it. That's as far as they'll go. And they won't be able to, either because they don't have the time, or because they don't have the expertise or the knowledge or the training to tell their patient, this is precisely what that pain is. This is what's causing it. This is why it's happening. This is why it's continuing to happen. And these are some specific things that you can do to alleviate it. So my goal with these two videos is to do exactly that. This video, hopefully, if I can keep myself from rambling too much, hopefully this video will only be about 10 minutes long. The next video is going to be demonstrations where I'm going to demonstrate very specific exercises that you can do. But I highly suggest that if this is something you're really interested in, if this is something that you've really struggled with, just invest the 10 minutes, or it might be longer, probably longer. Invest the 10 to 15 minutes in your health, in your knowledge and your understanding of your body. So that way you can apply what I'll teach you in the exercises, and you can go beyond that, and you can modify, you can do a bunch of different things because you have the knowledge, you have the understanding. And my goal when I work with my clients, my goal is, one, to make myself obsolete in their life. I want to empower you with as much knowledge and expertise as you can possibly handle, as much expertise as I can possibly give you. So that way, you know how to manage your pain. You know how to increase the quality of your life. You know how to improve your performance. You know what specific steps you can take to increase your longevity. So, okay, starting to get tangential again. So here we go. I've prepared a PowerPoint presentation for you, going back to my roots. Here we go. All right, I need to share my screen. I'll probably cut this part out of the video. I've just learned how to edit. This is exciting. All right, share my screen. Boom, boom. All these fancy sound effects. And then I hit this thing. Wow, there are so many windows with Zoom. Maybe I make that one go away. Okay, let's hit present. Present. There we go. Wow. Okay. And of course, I didn't start on the intro slide. Here we go. High production here, high production outfit. That's what we have going on here at Joshua Grainer Health. So The topic of this talk is how to relieve upper back pain. And you can see where this person or this man is grabbing his neck. This is so common, right? This is a very typical place for people to have pain that often is unaddressed for many, many, many years and really affects their quality of life, prevents them from being able to exercise, all the different things. Insert yourself in this situation. If you're watching this video, you know what I'm talking about. In this video, I'm going to give you a 3-step process that's clear as crystal. I want to be able to explain to you what this pain actually is, why it's happening, and then go over some general things you can do about it. In the next video, which I'll link in this video, I'll link this in the description, I'll show the exercise portion. But for now, 3-step clear process. So what is this, right? There's this upper trapezius, this upper back pain. There actually is a specific name for it, and it's called dorsoscapular nerve. And I don't know if you can see my little cursor here, but here it is, the dorsoscapular nerve entrapment. And if you can see the course of this nerve, this probably corresponds with a lot of your pain. Now, the thing that you're not seeing here is how the nerves connect to the brachial plexus, the nerves that go down the arm, which we'll actually talk about later, which can explain why you'll sometimes feel numbness, tingling in your arm that is often misdiagnosed as carpal tunnel syndrome. And unfortunately, a lot of people will get carpal tunnel surgery where a surgeon will actually open up space within the carpal tunnel within the wrist, and that doesn't really alleviate the pain. And there's a variety of different reasons for that that we can go into in a different video. But a lot of that pain really is coming from entrapment of this nerve here behind the shoulder blade, and then other entrapment. If you're going to have entrapment in one area, you're probably going to have entrapment in other areas too. It's not just a one area thing. So you could be entrapping the nerves around the armpit and the front of the chest and things like that. So what are you dealing with? Most likely it's a nerve that's caught or entrapped by a spasming or contracted muscle. And again, the condition, the general condition, this might not be the specific thing, but it's okay. We can use specific diagnoses in order to point us in the right direction. The dorsoscapular nerve entrapment, basically what this means is the nerve can't freely glide through one or all of these following muscles, the scalenes, the rhomboids, and levator scapula. This isn't necessarily an anatomy and physiology lecture, but essentially the scalenes come here from the occiput, from the bottom of the skull, and they connect down through the collarbone or connect to the top of the clavicle, the collarbone, the outside of the clavicle, and they turn the head and they flex it towards the same side. The trapezius muscles extend the neck backwards and rotate the neck up and back. They also rotate the shoulders up and back, which is something that we'll do when we do the exercises. The rhomboids, which are here between the shoulder blades, squeeze the shoulder blades together. And the levator scapula, just like the name shows, levator, like it elevates, scapula meaning shoulder blade, it elevates the shoulder blade. But when the shoulder blade is in a fixed position, because it connects from the inside of the shoulder blade up into the neck, it actually pulls the neck back, extends the neck back, and rotates it to the same side, right? So when we're dealing with this entrapment of the nerve, what's happening is the nerve itself is unable to glide freely through the tunnels where these muscles exist, right? So you can think about a nerve as being kind of like floss, like dental floss. And you want that floss to be able to move freely through between your teeth. When it's not able to do that, that usually indicates some type of problem. Another thing about nerves I think is really important is people think of nerves as something that's very fragile, but if you've ever dissected a cadaver, if you're in medicine, or if you've dissected an animal and you've identified the nerve, they're actually really tough. Nerves are really, really tough. In fact, you can if you expose a large enough nerve, you can just grab the nerve and you can lift a limb off the table if you're doing a cadaver dissection. They're really, really tough structures. They also require a decent amount of blood in order for them to be flexible, right? You want your nerves to be flexible. So think about your nerves as being like dental floss that needs to be very flexible. If you're not getting enough blood flow, which we're going to talk about in just a moment, if you're not getting enough blood flow to the muscle and to the nerve, that nerve will begin to desiccate or begin to shrink and become a little bit harder. Right? It doesn't bend as easy as it should. It becomes less resilient. And then the nerve itself isn't able to glide as easily through the tunnel. Like the nerve has a tunnel that, basically as it goes through each and every joint, it has a tunnel that it glides through. And if that tunnel, you can think about a straw, and if you take a straw and you're looking down through the straw and you pinch the straw, you won't be able to see through it. That's essentially what's happening with the tunnel. So that's essentially what's happening here in the dorsoscapular nerve. That tunnel that the nerve runs through has become squeezed. I was going to say squozen. I don't think that's a word. Squeezed. And as a result, the muscle, or the nerve rather, is not receiving enough blood, which makes it desiccated. It also makes it really sensitive, right? Think about this. Like if you sit on your hand for, let's say, 3 to 5 minutes, then when you pull your hand out and you touch your hand is really sensitive, right? You've pushed all the blood out of your hand, and those nerves are now going to be very, very sensitive. There's a very specific reason for this. I'd love to tell you about it, but I'll tell you about it at a different video, because then we'd have to really get into a bit of anatomy, physiology, and neurology, which I love, but I'm already starting to ramble. But yeah, when a nerve doesn't have enough oxygenated blood, it's going to become sensitive. It's going to become tense. It's going to become tight. And when the tunnel around the nerve begins to collapse in on itself because the muscle becomes overly tense and tight, and the muscle itself doesn't have enough oxygenated blood, then the nerve also becomes trapped. So when we're thinking about nerve pain of this type, like a dorsoscapular nerve entrapment, a peripheral nerve problem, there are 3 reasons for the nerve to be for the nerve pain to exist. Is because the nerve is either tight, it's trapped, it's sensitive, or all 3. And for people that have been dealing with this for a long time, it's generally all 3: tight, trapped, and sensitive. So this is just to show you another illustration of this dorsoscapular nerve, right? It comes from the 5th and 6th. It exits from below the 5th and 6th cervical vertebrae in the neck. This right here, this is that muscle I was talking about, the levator scapula. You can see how close it runs to this levator scapula, and then it dives down through the rhomboids major and minor. And it comes down here through the inside, the inner edge of the shoulder blade of the scapula. Right? So again, the lack of free movement of the nerve, it happens because of 1 or 2 reasons, or both. And it's that the muscle becomes in a state of chronic spasticity, it becomes spasmed. And in more advanced cases, and usually this happens when somebody's been injured, or in situations where somebody's got a chronic autoimmune disease like rheumatoid arthritis, lupus, things like that, the inflammatory process to repair the area after an injury can actually create what's called an adhesion, where the connective tissue, the fascia, the connective tissue that binds everything together, you get too much connective tissue in that area, and that can cause that nerve to be trapped as well. But since we're not really talking about adhesions so much, because, let's face it, the majority of people who are dealing with this type of pain, they're not dealing with it because of it. I mean, some people are dealing with it because of some type of injury, but most of it is progressive, right? Somebody just started feeling this pain one day, and it just kept on getting worse and worse and worse over time. And we're going to say that's usually associated with a muscle spasm. If you're dealing with a very specific injury, either to your vertebrae, to a disc, or if you've had, trauma, right? Actual blunt physical trauma to that area. Some of the stuff that we're talking about can apply, but in that case, seeing a specialist who could actually go in there and relieve those adhesions, that would be the better course for you. And we'll actually talk about that in a few slides. But I just want to let you know, for the vast majority of people that I have seen in my clinical practice over 15 years or so, and also, in some cases, my own pain that I've dealt with, it's been progressive. It's just gotten worse over time. Started as something kind of nagging and then just got worse over time. So this begs the question, right? If a lot of this upper back trapezius pain, right, this dorsoscapular nerve entrapment pain is associated with muscle spasm, why do muscle spasm, right? This is a great question. This is a question I would get from my patients all the time. Honestly, because a lot of their other medical providers didn't know why they spasm. They just, oh, it's a muscle spasm, I'm not trying to put myself above any other medical provider, but I just ask questions. I ask hard questions. When I was in school, I asked hard questions. I ask hard questions all the time of myself. I want to understand why this stuff is happening, right? So why do muscle spasms, right? The reason is, or at least one of the main reasons, is the chemical environment within the muscle tissue itself changes. It becomes unfavorable for activity, right? So what we're looking at here are these fascicular bundles of muscle tissues and muscle cells, right? These muscle fibers. And notice that they're red. As is most muscle is going to be red. The vast majority of it is red. Even, what people call dark meat and white meat, light meat still has a lot of oxygenated blood in it, because the muscle itself requires oxygen. It requires electrolytes. It requires glucose. It requires blood, right? So when a muscle is not getting enough circulation, the blood going from the heart, the lungs, oxygenated blood to the muscle tissue, when it is impeded for whatever reason, that muscle loses its neurochemical balance. It loses its electrolytes, it loses its protein, it loses its glucose, it loses its oxygen, it builds up a lot of carbon dioxide, which is converted to a chemical called carboxylic acid, which then makes the environment within the muscle cell very acidic. And then what happens? Then the muscle begins to pulse, it begins to spasm, right? The same thing happens to the muscle of the heart when it's starved for blood. We call that a heart attack, right? Or we call that angina, where the coronary artery is no longer able to deliver oxygenated blood to the muscle tissue itself, and the heart muscle begins to spasm. And what do? We put an AED device on it, and we send an electrical impulse through the heart to push the deoxygenated carbon dioxide rich blood out and pulling the oxygen rich, glucose rich, electrolyte rich blood back in, with the hope that the heart will then begin to start again. And the same thing happens with the muscle tissue, right? So we can think of a muscle spasm as being a neurochemical or electrochemical deficiency caused by inadequate circulation. Okay, so why does that happen? I mean, does the muscle just one day wake up and say, okay, well, I'm done receiving oxygenated blood? No, it's usually caused by a couple of different things. One of them is injury, right? You can actually have, if you get hit, if you land a certain way, if you become overly stretched, abruptly. This happens when people are, if they work on trucks and they step off the back of a truck and they're about to fall, and they reach their arm out and they grab the edge of the truck just as they're falling, and they get a minor or not so minor muscle tear in their arm or their shoulder. This is something that could cause it. But for the vast majority of people, this is going to be the muscle spasm is going to be caused, that the ischemia, the lack of blood flow to the muscle, is going to be caused by overuse and repetitive strain. Mental tension can also be a big player. When people become tense, like this, if you've got a chronic pain condition, when you feel tense, when you feel mentally tense, when you feel emotionally tense, when you're under the gun, you don't have enough time, or your partner is barking at you for some reason, or your kids are have lost their damn mind, and you feel really tense, a lot of times you'll start reaching for your neck, right? Because mental tension creates physical tension. And if you have a weak link, which is an area where an area of your body that's not getting adequate blood flow, that area is going to be triggered one of the first. So of the different forms of muscle spasm, you can have a muscle that gets stuck in the locked short position, right? This is, if you look at this description of this illustration of the guy, you can see which muscles are long and which muscles are going to be short. So you can look from the back of the neck all the way to the mid back. All those muscles are going to be overly lengthened. The front of the neck, the front of the shoulder, the front of the chest, all those muscles are going to become shortened. When a person's in this position for an extended period of time, that begins to push blood flow out, right? So blood flow is being pushed out of the muscles in the back, right? You're literally making it difficult. The person is literally making it difficult for the blood to reach the muscles because the muscles are in an overstretched, in a locked long position. And it's having difficulty reaching the muscles in the front of the chest, the shoulder, and the front of the neck because those muscles are locked short. And then you add on top of that, being immobile for long periods of times, 2, 3, 4, 5 hours, working on something that's really stressful. And then you throw in the mental and emotional stress. And now you've just created a perfect recipe for a chemical environment within the muscle tissue that makes it so that it's prone to spasm. So then what are the actual causes of this dorsoscapular nerve entrapment? And the etiology, the pathomechanism, the reasons why this happens is from the majority that I see is from overuse or repetitive strain, meaning that you're doing something with your body a certain way, every day, multiple times per day. And those muscles aren't, one, given an opportunity to recover, and two, develop dysfunctional movement patterns. The second thing that I see in the vast majority of people that I used to treat for this condition is postural imbalances. Like we saw in that previous slide, the guy with his head forward, shoulders slumped forward, rounding in the upper back. These postural imbalances, when held for long periods of time, they will create this locked short or locked long combination, which then results in muscle spasms. Training imbalances, right? For people who are doing very specific sports or who are training for bodybuilding and they're working out a certain area of their body more than the others, and they're creating an imbalance, which is, an extension of a postural imbalance. It's a functional postural imbalance that can create this imbalance that causes constant and chronic muscle spasms. And then prolonged immobility, progressive weakness, right? This is part of living a sedentary lifestyle. So many people, they just don't work out, don't exercise. Maybe you hit the gym once or twice a week. It's just not enough. Our bodies were designed to move. If we're not moving, we're going to get sick. And of course, mental stress. So then what do you do about it? Right? So that we can divide this into 3 different categories. One is self-care. This is the most empowering. This is the first place that you should generally go, as long as it's not, a severe emergency situation. But self-care should always be the first place that you go. It's where you continue to put your energy and your effort, and it's the last thing to give up. So self-care, self-care, self-care. And in the next video, that's where I'll show you some very specific movements that you can do. Then there are conservative therapeutics. These are, well, here, let's use these slides. I put these slides together, right? So here's our self-care. Strengthening exercises, mobility, postural correction, stress reduction, and then using things like a self-massage. And I put this down in kind of like my hierarchy that I think is the best. For self-massage, a foam roller, fantastic. A PokeMat, I'm sure you've seen these. Like they've got brand names, but basically it's like a squishy mat with all these little spikes on it, the plastic spikes, and you lay on it. I found that to be really, really helpful to manage the pain. That doesn't necessarily get rid of it, but it definitely manages. You can have a massage gun where if you've got a partner or friends that can use the massage gun, right? This vibrational percussive massager in that area, that can also be really helpful. And then TENS, which is a type of electrical stimulation that you can either use with pads or in some cases acupuncture as well. And then there are conservative therapies. These are things like physical therapy by physical therapists who really understands these things. Unfortunately, I'm probably going to get a lot of heat from a lot of physical therapists. They might have studied these things in school, but then when you see the prescription of exercises and their approach, you realize that they don't really understand the problem. So if you find a good physical therapist who is really good at these types of things, who really understands the process, understands the physiology, why it's happening, and the way that you know it is because they can explain it to you in a way that makes sense to you, right? If I'm trying to explain to you why dorsoscapular nerve entrapment, what it is, and I'm just talking to myself and using a bunch of fancy words, and you walk away knowing nothing, then that probably indicates that I don't really know what I'm talking about too. I should be able to explain it to you in a way that makes sense, right? So, this is a side note, but, just because you're assigned a medical provider doesn't mean that has to be your medical provider. You need to interview your medical providers and make sure they know what they're talking about. Make sure that they have your best, your best health is part of their highest intention. So beyond physical therapy, we have acupuncture, and there's a very specific acupuncture that I really favor, and it's called motor point needling, where the practitioner puts the needle in the area of the muscle that has the most amount of nerve endings. This is called a motor point. And by doing that, if they do it right, at the right angle, at the right depth, the right stimulation, it can actually have a very similar effect to the heart that is going into fibrillation, and you send an electrical signal through the heart, and the heart, it pushes out all the old blood and sucks in all the new blood. A very similar thing can happen with an acupuncture needle if the practitioner knows what they're doing. They're basically resetting that muscle tissue, that muscle fiber, using an electrochemical stimulation just mechanically with the needle. It's pretty amazing. And then massages also can be great for people who've had this pain for a very, very long time, or if it's also in the very acute phase where you've just injured yourself. Massage could actually hurt and maybe not make it as good, at least deep tissue massage, right? So physical therapy, acupuncture, motor point needling, specifically of the acupuncture, and massage. These are the conservative therapies that I've found to be really good for this condition. And then there are interventional procedures where you have to go in for some type of surgical procedure, which is generally an injection called a nerve block, where they inject cortisone in and around that nerve. And then if that doesn't work, they use that as a diagnostic too, right? So if it works a little bit, they're like, oh, okay, well, it works. Maybe we should go to the next phase. If it doesn't work at all, then they go a completely different path, or maybe say that what you have is it's not going to heal. But a lot of times, the interventional pain doctors will inject a cortisone injection. If there is some benefit from it, but it doesn't completely make it go away, then what they'll often do is they'll ask your insurance, they'll get Medicare, you'll get a prior authorization to do what's called a radio frequency nerve ablation, where they actually go in and they destroy part of that nerve using a radio frequency, right? It's basically like using very, very, very high heat to cut that nerve. And before they used radio frequency, they actually used heat instead. They used like a cauterizing needle to do that. And for some people, if that doesn't work, then a lot of times they'll progress onto Botox injection, where they actually make that muscle that's spasming, they actually turn it off using botulinum toxin. Okay, so I'm sure you're looking at this slide, and maybe 10%, 20% of you, if you're watching this, you've probably had one or all of these things done. you know that there's complications, right? You can just look at this and say, oh, there's got to be complications. There are definitely complications. That's not to say that they don't work, that they're not helpful, but they generally work in if they're going to work, they're going to work in the short term. They don't necessarily address the underlying problems, right? So here's the slide: problems with procedures. They don't correct the underlying causes, right? If you're having chronic muscle spasm because of your posture, because you're immobile, because you're experiencing way too much stress that's unmanaged, having botulism injected into your muscle isn't going to address that. It's going to help the symptom temporarily, but it's going to come back, and a lot of times it's going to come back with a vengeance. And there can be side effects. In fact, some people, after they have the radiofrequency ablation, actually say the pain is worse after the pain has came back. And there's a reason for that. And maybe I'll do a video specifically about the neuroscience of chronic pain and how, how the brain gets involved too. But that's out of our depth for this, and I'm already rambling, but that's out of my depth for this video. But just to say that when you give other people control over your health, over your quality of life, please do it carefully. Whether it's a massage therapist, an acupuncturist, a physical therapist, a surgeon, an anesthesiologist, a pain doctor, don't just say, oh, okay, well, that's what the insurance is going to cover. Sure, I'll do that. And I know, I'm probably sounding a little bit overly cheeky here, but man, this is coming from so many years of experience of seeing people that have just, they've followed along, they've stepped in line, they've done the thing that their primary care doctor said that they should do, which, at 99% of the time, the primary care doctor is just doing the best job they possibly can, right? This isn't to necessarily knock a provider or the medical system, although I have a lot to say about that. They're doing the best job they can with the tools that they have available. The problem is those tools aren't always functional for a lot of people, and they don't really take the time to figure out exactly what that individual person needs. So as a result, you have side effects. You can often have pain that comes back worse. And unfortunately, a lot of times doctors will, at a certain point, they'll just, you can't see that, but I'm just doing this like wiping thing with my palms of my hands and saying, you know what? We've done everything we can. There's nothing else we can do. You've already done physical therapy. You've already done the injections. We've already ablated your nerves 2, 3, 4 times. We've already injected Botox. I'm sorry. There's nothing more we can do. And then guess what? They're no longer responsible, because eventually, at the end of the day, I hate that phrase, but at the end of the day, you're responsible for your health, right? So that brings us to what is going to be the next video, which you can access by clicking on the link in the description below. It brings us to some self-care routines that you can do. So then this begs the question, where do I start, right? Where do I begin? Do the following strength and mobility exercises. Do them every day, even if they're a little bit uncomfortable. If they're horrible, if they ruin your day because you did these exercises, don't do them. But if they're not horrible, if they hurt just a little bit, then keep on doing them, right? Be aware of your posture. Pay attention to how you hold your head, how you hold your shoulders, and how you hold your neck, right? The idea isn't to always have your shoulders back, right? The military posture that people think about, right? We call that being uptight. I'd rather have you be upright, right? So it's like your head moving up towards the ceiling, your shoulders broad, your chest open, your belly relaxed, right? This type of posture, whether you're seated or whether you're standing, be aware of your posture. If you're dealing with this type of chronic musculoskeletal pain, whether it's pain in the knee, pain in the leg, pain in the back, pain in the neck, pain in the shoulder, move often. Get up and move often. Don't just sit there and think, okay, well, I'm at least a little bit comfortable in this position. I'm not going to do anything. No, get up and move your body. Do it every 30 minutes. Do it every hour. For my patients, I would have them actually set a timer. And if they were sitting for long periods, every 30 minutes, I'd have them get up, go for a little 1-minute walk around their office, walk around their living room, do a couple of stretches, do a couple movements, right? You want to keep that blood flowing. And then reduce mental tension, you know. I have a newsletter I've got all of 35 subscribers today, which is fantastic, but I've only had the newsletter for a little while. But the whole idea with the newsletter is to give you actionable tools that you can use for all these different things, right? I want to help you improve your cardiometabolic fitness. I want you to increase your muscle mass. I want you to reduce joint pain. I want to help you increase your libido. I want to help you have more meaningful connections and relationships in your life. And these are things that I talk about, and these are tools and strategies and books and things like that that I will introduce you to through this newsletter. So if any of this is helpful for you, I highly request that you sign up for my newsletter. You won't be disappointed. And one of the things that I also do is I've got an online free guided meditation if you want to try that type of thing out. And if you sign up for the newsletter, you'll get access to that. Okay, so let's stop sharing the screen. And here I am. Thanks for hanging out with me for the last, I said it was gonna be 10 minutes, it was much longer, but I hope this was informative and helpful for you. I'm gonna continue putting out videos like these, even if only one person watches it. If I help one person out, it's totally worth it to me. But check out the next video. I'm going to show you 3 specific movements that you can do to alleviate this pain in your upper back and shoulders. Okay, see ya.